Margaret, you showed up as the host.
I know, and thank God. I'm really sorry, guys. I have no idea why it didn't do that before.
Sorry, guys, hang in there with us. We got to fix this.
Very sorry. Okay.
Well, that seems to have worked. A little bit of feedback.
Margaret, as the host, you might be able to remove people.
Yeah.
Okay. Let me look at that.
Margaret, now that you're the host.
Well, I think that has worked.
Finally.
Margaret, if you have a cell phone near your computer or tablet and you're hosting, that's going to cause that reverberation.
Hi, Dave. Yeah, I don't, but it's weird because I also can hear you, and I just told it to mute everybody. So, oh, did you unmute? Did you unmute yourself?
I unmuted, but I'm going to mute again.
Oh, okay.
Yeah, please.
Yeah, but you know what? So Dave's point is good because maybe someone has a cell phone near the thing. But otherwise, I at least was able to mute all. Everybody, don't unmute yourself except for me and Tom. And if you have a question, put it in the chat or use that little emoji that lets you raise your hand. All right. Thank you for your patience.
So I think we're up and running now. Margaret, can you hear me?
Yes.
Okay, so I think we've got that resolved. Perfect. So I, you know, not to repeat, but to really just know that suicide prevention or post-vention or grief support training, excuse me, can be a challenging subject. And so I want everyone that's on the call today to practice self-care. If at any point during today's training you feel that you are being challenged by what's being discussed, or you're somebody that's lost somebody to suicide recently, or even just period, or somebody with lived experience, it's okay. Step away, take care of yourself. Reach out to Margaret, reach out to me, reach out to those important people in your life that can help you if you are challenged. This is a part of virtual training that's not good for suicide prevention, post-vention, and grief support, but we live in the world that we live in now. So please, please, I encourage you all to take care of yourself, and don't be afraid to reach out to somebody, Margaret or myself or whomever in your life, if you are indeed challenged. You can see by the intro slide here that I have a lot of background. I'm going to offer, for those of you who don't know, I'm a lost survivor to suicide. I lost a son to suicide 10 years ago. That's why I am so passionate and connected to it. I'm a retired Y director. I don't need to do this, but I want to do it, and that's the key. Because I think, and you all being participants today, hopefully we'll learn something and become passionate as I am, and really be able to move mountains into your community to put safe protocols in place. So when it comes to suicide prevention, which we all do, many of you on this call today have either become a trainer under me or have heard my suicide prevention training programs, whether it's Talk Saves Lives or QPR, and that's great. And we've made a really good start in Connecticut with that. But now we want to really take it to post-vention and to grief support, because all three pieces are important. So you can see in this thing, suicide post-vention is prevention. And I think after you hear the presentation today and begin to kind of digest the information that you're going to get, you'll see what I mean. So let's begin. So some goals of today's training, and by the way, I don't read my slides. I promise you I won't read the slides. It's really up to you to read the slides, but I'm going to do a quick review on prevention, warning signs, risk factors, give you some information. I'm assuming that most folks have some sort of background, and that's great. Hang in there with us. For some folks that don't, this is really important information. It's why we do what we do. We're going to identify protocols and best practices on how to develop a post-vention plan. And, in the short version is when there's a death by suicide in the community. How do we respond as a community to help people stay safe and to support those who have just had a major tragic loss and a loss of life in their life? And so we want to do that. And the third thing, which is key, and we're going to talk a little bit about, is developing a post-vention team, which is, you can be easily set up in an organization, or can be part of the community, the emergency response task force that many communities have. This post-vention team can be easily connected to it, or it can stand alone. However best your organization fits is I think, so critical. And we'll walk you through that. And I think you'll see that it's not a particular community's problem. It's everybody's problems. And I say that because sometimes folks think, well, post-vention is it's just a school problem. And it's not. It's everybody. So I call it the wire that we connect everybody to. So we want to be sure that we're connecting that wire when it comes to suicide loss, and how do we best handle it, and how do we best support those who have experienced a loss and are challenged by the loss. And some principles about today's training. I mean, if it's not a public health problem, and you don't agree with me on that, we might want to have a separate conversation, because it's clearly a public health issue. And you can see some of the other key components to it: taking the right action. How do you support people with loss? It's just not a youth problem. It's a lifespan problem. And so being able to look at it in a more broader perspective, I think, is critical. And so try, for those who are coming from a particular organization or school, you might be thinking quite along that lines. And I usually, professional hat on as opposed to your community hat on. So do be ready to switch hats, if you will, when looking at this, because it is a broad-based approach. And then really talk a little bit about cultural factors and the things that relate to the different cultures, so that we're all at least sensitive to it, and to families' needs and families' wishes when there is a suicide loss, because I think that's also very important. And then communication. And when there's a loss by suicide, communications are so important. And that's a conversation when you develop your own plans in your own communities or in your organizations, you must have. Because with the cell phones and the digital media and all the platforms where your news happens in minutes now, and even sometimes in seconds. And so when there is a loss to suicide, how we communicate it and how we work with families is so really very important. So a little bit about suicide, mental health, and stigma. I'm going to give you some data here, kind of hopefully fill in some blanks for you. This is an interesting stat. I've seen it at 80%, I've seen it at 90%, but most people who die by suicide either have a mental health problem or substance use problem, or many times both, which is what the pros call co-occurring. So really very, very important that we understand that. Suicide and mental health problems also have stigma, and yeah, the stigma around suicide is incredible. Speaking from my experience, 10 years ago, it took my wife and my other two sons and I some time to get over the fact that we had lost a brother or a son to suicide, and that, are we a bad family, or are we bad parents, or did we do something wrong? And that's community stigma, and we need to get rid of it. And you can see some of the other points there that are on there as well. Here's how some increased risk factors for suicide. And I particularly like it. It's an older slide you can see in the footnote, but you can see how the general population is affected from these certain disorders or brain diseases, and how much other folks are really in these particular categories are exposed or have a potential to have suicidal thought or suicidal ideation, and don't have the tools, or are not being supported or getting treated to help them on a journey of wellness. This slide, and it's an interesting slide. I'll let you read through it, but the critical piece about this slide is suicide is complex. It affects a lot of people. We talk about phrases like committed suicide. Well, people commit crimes, they don't commit suicide. Suicide is a symptom of something else going on in their life. And when you look at this slide as these social, psychological, and geographic cross over, it's how the risk gets worse. And so in prevention, as we learn in prevention work, when somebody's struggling with suicidal ideation or thought, or probably at the most top of the risk, it's all about time. And it's usually that 24 to 48 hour period where they're really most at risk. And if we don't intervene or provide research or support or ask the question, are you thinking about suicide or thinking about killing yourself, and connect them to professional help, is absolutely critical. It's the key is time. And that's really what this slide is saying. It's kind of a different way of presenting it, but I think a good visual to understand. It takes multiple factors for somebody to get to the point where they're considering taking their life. So what is postvention? That's why you're all here today. And it's a planned response. And I know there's some school systems on the call today, but in my volunteer work with the American Foundation for Suicide Prevention, I speak to people all over the country. And when there's a death by suicide in a particular community, it will shock you to know that most communities don't have a planned response. They might have an unofficial kind of way, or maybe a school has a plan, but the social service department doesn't, or the elected officials' offices don't understand it. That's why we want to have a planned response. We want to sit down and say, what are the scenarios? And on Monday, we're going to do an activity in that. And I hope that will really drive home to you all the fact that having a planned response is so important, so that's a little bit of a promotion there for Monday, because the post-vention activity is really solid to bring us all to the point that we know that we need a planned response. Knowing someone who has died by suicide increases the risk of others. So it just doesn't impact the immediate family. It impacts an entire community, like the community that person was connected to. and really how we deal with suicide, especially with young people, is very, very important. So having a post-vention plan in place can help keep these folks safe while they begin to grieve and mourn of a loss, and understand that their mental health is just as important as their physical health, so that we can convince them to get help when they are struggling or challenged.
And Tom, before you go on, we were going to stop here to see if there are any questions thus far. And while you cogitate on that, I just want to point out that everything Tom's talking about here in terms of having a planned response, he mentioned schools as one area where like a school district having a response plan that's really carved out in writing and roles identified is really important. Obviously, we're hoping with a lot of the municipal teams on this training today that our towns and our cities right here in Southwest Connecticut are going to create such a plan after this, but it can really affect any institution. So I'll give a shout out to Recovery Network of Programs that has a whole bunch of people here in the training. And they, you know, given the size of RNPs, the size and the reach of what RNP does and all the levels of care you address, you know, being able to have an institutional response plan would be amazing. And then as well, I'm hoping participating in the Bridgeport suicide response plan. So I see a comment in the chat from Larry Robinson talking about the high suicide rate among veterans. And that's obviously, yeah, I'll let Tom comment on that. And okay, a couple others. So, and Anna Keegan is mentioning trans people. Yeah, and you guys, you can unmute yourselves. I think if you want to say something now, we want to have a little bit of question and answer right now briefly.
The first couple of questions that I had, the military, there's a lot of work happening from the Department of Defense as it relates to suicide prevention, post-vention, and support, not only for the soldiers, but also for the families that it's related in. Our National Guard has a mental health like division, if you will. It operates out of Middletown, through the National Guard Center up there. So they're on it, but unfortunately, we're losing 20 some odd veterans a day to suicide, and so it's a major initiative on the Department of Defense. And there's been a lot of work up to this point, but boy, we sure do need to do a lot of work. Yeah, the LGBTQ plus community is 4 times more at risk for suicide than their counterpart communities, and transgender is 6 times more at risk for suicide. So that's a population that we need to be sensitive to. We need to communicate with, have open conversations and discussions. There are prevention programs out of AFSP called Talk Saves Lives in the LGBTQ plus community, where is a good start to begin to have that conversation and education, and then certainly those organizations that serve that population can come up with their own kind of protocols and policies, so that we keep people safe. I was on a training call, Talk Saves Life training call, where we, my co-host and I, literally had to stay and call after the training was over, because 2 of those folks were challenged, and we were able to have an opportunity to talk and make sure they had support people around them for that self-care thing I talked about earlier.
I just want to add on the subject of trans people, the Trevor Project just recently released their 2020 survey on LGBTQ youth and suicide and mental health, and it's online and great graphics and everything else. But one of the protective factors they highlighted was that people who reported that others respected their chosen pronouns were less likely to attempt suicide than trans people who were in an environment where people were not respecting their pronouns. So I think that's a pretty actionable thing we can do. Couple other comments that are just coming in the chat. are people really commenting on who are the high risk folks. And of course, like anyone is a potential risk factor. So Jeff from Rocking Recovery said we're starting to lose more police officers and firefighters to suicide than line of duty deaths. And that's correct. And we had an officer respond to that. We definitely have a few police officers in this call. That's absolutely true. And I'll just take this opportunity to make sure everyone knows that there's the 1-800-COP line number, which is cops providing each other peer support around mental health and suicide, and other folks commenting on teens and young adults being at risk, peer pressure and bullying. And then of course the medical professionals treating COVID patients and anyone who's a frontline healthcare worker is at increased risk kind of the PTSD type of thing. Physician suicide in particular is a much larger problem than most people know, and likely to be a larger problem now after COVID. I think if you have any other comments, you guys probably just add them in the chat at this point, because we should move on to the next set of slides, and we'll stop again in a few minutes to talk.
Yeah, just a quick comment on some of those responses. All very, very good and very, very powerful. A couple of key things to know that the part of the population that's more at risk for suicide is the white male, non-Hispanic male, ages 25 to 55. That's true here in Connecticut. That's true in the nation. What we've also seen as far as the data that we should all be kind of put our heads around is more women attempt suicide, but they tend to use overdose or poisoning. And here in Connecticut, you can pretty much get to an emergency room in 15 minutes, so it can be reversed. Men attempt suicide less, but they die more. And that's because they tend to use more lethal means. Our state here in Connecticut, about 1/3 of the suicide deaths, and this is pretty stable over the last 3 or 4 years, it's about 30% or 1/3 are dying by firearm as it relates to suicide. It is a lot harder in other states, and so so it's just not firearm. It's other lethal means that are causing deaths in our states, and we need to be sensitive to that. One of the things you're going to learn in a few slides is talking about suicide, and especially about means on how people die by suicide can be very, very risky. So we have to be very careful how we talk about means when we do talk about suicide in a general community setting. So let me move on. As you can see, post-vention protocols, the first 3 to 4 days are really very, very important. And it's how to kind of know that, with social media and things getting out of control, and it's about having a proactive protocol grounds that everybody follows through and everybody monitors. And certainly the last one is, what are those communication and funeral activities and memorials and those kind of things that we need to be sensitive about, and what are the best practices around that based on what we know on suicide loss. So, excuse me. So let me move on. Your post-vention plans need to be able to be certainly developed in advance in practice by using the activity we're going to do on Monday, so that, and we'll talk about how to do that on Monday, or definitely on Wednesday, when you build your plans, so that you act quickly. The committee would be the one that would mobilize it, and then you'll see when I show you slides of setting up the committee and how the interaction of that committee can work. You need community safety and obviously resources, and then understand procedures that include a broad base. And I said that earlier, sometimes agencies, schools, whatever, have their own, but how do they interconnect? How do they wire into the rest of the community? So here's some more. Right? Flexibility, sustainability, people change, you build a committee, and then the people, maybe the positions don't change necessarily, but the people change, which means you've got to go over this plan on an annual basis and revise it, free of bias, and I think that speaks loudly, and then understand that it's a complex issue, and there's no other death like suicide. When you look at all of the ramifications connected with stigma and all of the challenges that folks who are struggling, and then certainly, after somebody does die, how it really impacts. So it's really important. And then the last one is we need to, the words that we use and how we communicate is really important. I'm a retired YMCA director for 30 years. I thought the Y had a lot of acronyms. Well, I was wrong because the prevention field has way more. And, so we got to be careful on how we use those acronyms because the general public most likely won't understand them. So building a plan and communicating is really important without using, I put the word jargon in there, but I think you get a sense. It's certainly in your own organization. It's really important to use acronyms to communicate quickly and effectively. Just remember that your immediate community might, but not the whole community as a general source. Cause and death, a matter of death, and this is a tough slide as you read through it. Suicides in Connecticut, or really untimely death in Connecticut, is all investigated by the chief medical office. Suicide is not made official until the chief medical examiner's office rules it. So what does that mean, Tom? Well, that means that when there's an untimely death, police come on the scene and they first consider it a crime scene. And this can be very difficult for the people, the close family members who are just now experiencing for the first time this kind of tragic loss, and not understanding that's what's occurring until the investigation can be complete. Sometimes it's easy, and then it doesn't take the chief medical examiner's office long to rule. But then sometimes it's really bad, and it takes sometimes weeks or months. And in my case, when my son, the chief medical examiner didn't rule that my son Tyler died by suicide till 8 weeks after he passed. And so understanding that, I didn't understand that then. I was frustrated, but now that I do understand it, it makes a whole lot of sense. And I know this is the second to last one is tough, but as a community, when there's a death by suicide and it happens in the family home, we need to be there for these folks, because that could be a very, very challenging scenario. And the lost survivors to suicide that I talked to that's happened, and it didn't happen to me. My son was attending college when he died. But when something like this occurs, the community needs to be there and support and understand that, and build a support system or safety net around to help with some of the aftermath of suicide. Cause and death really important, and I hope that by reading the slide you've learned something new today, because I certainly didn't know it, and I think it's all really important information to know as you build your post-vention plan in your community or organization, that you fully understand it and your plan reflects it. A few words about contagion, especially those of you who are serving youth, and certainly our youth can be potentially at risk, but it is more important for us to understand that for youth suicide, there, and in particular, as I talked to administrations across the state who are working on their post-vention plans, that there are other students in the school who are also challenged. And if we don't handle post-vention correctly, we can easily create a contagion scenario where now 2 or 3 students have taken their life, or 2 or 3 youth. So it's really important. It also happens in adults, but not as frequently. It's not as apparent, but teens and young adults, we certainly need to be very cognizant of that, which is why handling how we report and how do we deal with a post-vention in a communication format is so critical. And you can see the bottom, and we're going to talk about this here today on future slides, that how we report it, how do we handle it, and it's certainly inappropriate ways, funeral service, memorial services, that kind of thing. And I'll share some examples when we get there, and how to best handle scenarios like that. But these are really all important when it comes to contagion.
Tom, just before you move on, did you want to comment on the top of the slide mentioned suicide pact, cluster, and copycat as different types? Did you want to comment on that at all?
Yeah, thanks. Yeah, good heads up. They're different. So there's 4 different parts of contagion. The first one is more of a cluster. We had a town here several years back that lost 3 young people to suicide within a 6-week period. The fact was that these 3 kids didn't know each other. So there was no kind of suicide pact or cluster or a group of kids, suicide pact with 3 or 4 kids. So that was really considered a cluster. It just happened all at once. The copycat thing is certainly where, when you use you use unsafe practices when it comes to memorials that can easily put a group at risk. The example I share, there was a suicide death at a mall here in Connecticut, and where the young person took her life off the parking garage, off the top floor of the parking garage. Well, their friends were planning a memorial service in the parking garage a week or so after death. Obviously, that's not a best practice. And there was a group of folks that came in, leaders across the state in suicide prevention, that really helped, and this will surprise you, helped the owners of the mall to how to deal with it. And we were able to connect all the community partners in success. And I think as sad as that death was, we weren't putting other kids at risk, and we certainly didn't want kids to think that who are at risk, that would be a way for them to take their lives. So there's an example. So thanks, Margaret. That was a good heads up. How we talk about suicide in public is really important, and you'll see that first one, families' right to privacy. They do control it, and this can be frustrating. Margaret and I were talking the other day that because of social media, the family that she knew that wanted to keep it confidential, and certainly we have to do all that we can. But the reality is that because of social media, and not so good social media, everybody now knows it's suicide. So the key thing with families is to talk about it, and when a family does experience a loss, that we certainly will recognize their privacy or their perspective, but we could also at that time educate them that there are, because of your loss, it's put a lot of other people at loss, and research shows it's better to be open about it than not, so that we can make sure that those folks who are now more at risk because of the loss get connected to help. In the 2 experiences that I had with that, the family decided to keep it private, and you have to you need to support it and carry forward with that. And then certainly being open about how best to do funeral service, how best to put together. And in the case of the example I told you about the young person who died at the parking garage at the mall, those young people, that group of young people, we convinced them that they shouldn't do a memorial, and they ended up participating in one of the Out of the Darkness walks that Connecticut chapter for AFSP held. And by doing that, we were able to put adults and folks in place that have had training to support these young people as they grieve and healed from their friend's loss. So here, these are some of the important principles that we just need to understand, and glorifying a suicide may increase the risk, and you can see these points. And, you know, when there's such a dramatic loss, it gets complex, and that by putting up special dedications or having a kid's locker be decorated at the school, or you know, or a community have hundreds of T-shirts made up for a memorial, are not the best ways. It's really glorifying the death. Better ways is to use this time to educate on the positive qualities, and to be open and honest of what was going on with them, and how we can best take care from ourselves, from what we learned about the loss in their life. I hope that, you know, and certainly I'll ask some more questions on it, but it's really important to be open and honest with how anybody feels about loss to suicide, and communicate to them that it's directly connected to mental health issues, and we need, because we've experienced the loss, we need to watch our mental health as well. Lost survivor to suicide, as I explained to you early in today's training, that I am a survivor of loss to suicide, and this is the best way to describe somebody who has lost somebody to suicide. You know, friends, students, colleagues, professional staff, clients would all fall into the same category. And I can only speak for myself to say that as I learned about this and about the journey that I was now on, this phrase is comforting to me. So survivors of suicide loss is is the right term to use. So suggested funeral or memorial services, here's some guidelines for you. And when we do the activity on Monday, you'll see why I have this out, because it's connected to I'm doing sales pitch for Monday, but it's connected to it. And you can see coordinations amongst, amongst a group of people, because if we speak together as one, we can be sure that safe practices are put in place when there is a funeral or a memorial service, and that there's services there to help folks if they're challenged. Safe messaging is so critical when it's talking about suicide death. Keeping displays and notes, and remember, it's time limited. An administrative school system here back a few years ago that experienced a suicide loss. It was a challenge for them because the students wanted to memorialize, wanted to do. And my recommendations was, well, if that's a real challenge to you, allow it for a day or two. But use that as a springboard for other supportive services and those types types of services that you can give to folks now that they're grieving a loss. So, so if you have to, time limited is important. And hold a service time and place where adults can be with youth, I think is critical. Have the counselors there and provide information on suicide prevention and mental health services, so that there's a holistic approach to it. And certainly when it's with a youth suicide, you can include youth in that. If it's a family or general community or adult, there are people who are a part of that individual's sphere of life that can also help to put together something that's meaningful and that is healing, and that's the key, healing. Here's the safe messaging, and you can see these are all pretty self-explanatory. You can see the text line there and the 1-800 number, which is connected here in Connecticut to 211. These are some of the safe messagings that you can promote. Warning signs are okay to promote right after suicide death, because again, there's folks out there that are also challenged. So helping people recognize what those signs are, and just having a bit of sensitivity to it, or we can get them connected to help. Here's the things that you shouldn't. And there's that first one, description of the suicide incident. It is very, very important that it's not about how the person died, it's about how the person lived, and why they were sick, and what we all can do for each other, so no one else gets sick, and maybe makes an attempt or dies. You know, certainly that saint or celebrity. For those of you who are trained in QPR, I talk about Kurt Cobain and his family after Kurt. I mean, he was a great artist, and after he passed away, the family was very open about his suicide and some of the things that Kurt had been going through, and you know, and part of what they shared was this, you know, he was a humble guy at the beginning, and as he got the fame and all that stuff, and then he passed. The media and people in the community started making it a celebrity kind of thing, and his family was great, and when they got up right away in public and said, no, we're not, this is, and then began to explain to folks what was happening in Kurt's life when he did die. And so the key, simplifying causes, you know, is you just don't want to go into cause. It will be the communicated, social media will do it. And so as us as leaders or members of Post-Vention committee, we need to encourage people to stay away, because that's not healthy to potentially others. And at this point, it's not going to bring anybody back. They're gone. So, and then you see failed, successful, completed, committed, or all bad words to use when referring to a suicide death. Died by suicide's the way to go. That's the died by suicide is the most straightforward, generic, and realization. If a family has decided that they don't want it publicized as a suicide, or they want to keep it private, then you use untimely death. But then make an opportunity, as opposed to talking to suicide, you talk to the overall community, and your communications is about mental health and substance use, if appropriate. So those are some of the kind of things that you can do. And here's the electronic media slide. And my kids, my oldest is in 34, and you know, this thing is 400 times the computing power than the computer that my kids grew up with, which was located in the family room. The screen was this big, the box was that big, and we could monitor it. So this thing has made post-vention very complicated because of access to information. So we need to stay on top of it, and that should be a part of one of your post-ventions committee's only job is to monitor social media, who's comfortable in monitoring search, and when there's rumor and innuendo spread, you can immediately take action. And some of our police departments and community leaders and towns, social service departments have been working on this, which I think is a really good thing to do. Social networking, search for infant related to death, or all these things will happen. And then the issue with Facebook and Instagram is after there's a death, sometimes their page is deactivated or placed in memorial service, but that has to happen at the request of a next of kin. So just know that media is complex, and so you really have to have one person kind of leading the charge who's comfortable with that to monitor, especially immediately following the suicide death and 3 days later. So let me pause for questions again. Just threw a lot of information at you all. So Margaret, any questions in the chat?
Not yet, so we'll give people a chance. So we just went over memorialization, contagion effect, social media, funerals, messages to avoid or use, and talking about the cause and the manner of death as just some of the topics that Tom just went over. So I think that may generate some questions. There's a comment from Mark Blake, who works with the Emergency Medical Services in Westport, and he's commenting on being concerned about the mental well-being of EMS personnel. COVID-19 has made a dramatic difference in how we work, adding more stress emotionally and physically, responding to more psych calls, domestics, DOAs, and suicides, doing more field terminations, as some people aren't calling 911 because they don't want to go to the hospital because of COVID. And he's saying we must do more for EMS. So I want to actually take this opportunity to say that we are literally, the hub is submitting a grant to the Fairfield County's Community Foundation to fund suicide prevention and intervention training for EMS in our region. If we get this grant, which I think we will, because I talked about it with them ahead of time and they encouraged us, we will be able to offer the assist suicide intervention training to a couple people from each EMS unit, in addition to then making QPR suicide prevention training available to others from the units. But I think, at our last suicide advisory board meeting, we talked about the impact on frontline personnel, and it's tremendous. And I think EMS are really probably maybe most at risk in that category of personnel, because so many of them are volunteers, right? And like there's not the same level of, you're in an institution, like if you're a medical doctor, it's just a different whole setting. So I think that's a really important point. Tom, do you want to comment on EMS?
Can I tell you something? The nail salon is opened.
Yeah, I don't want to go.
Okay.
Which is crazy.
Yeah, I think from
I don't think
got somebody open mic there. Well, that EMS is at risk, and I'm trying to remember the term because I've done a lot of volunteer fire department work, and they're really interested in de-escalation. They're in that metal box that's 4x8 with a person who's the police officer on scene is basically pass the baton onto them, and now they've got to transport a person that certainly has had a mental health crisis or is in some sort of crisis, and so again, I think organizations like Cable, which serve the first responders, mostly police officers, are very involved in trying to provide training like that, because de-escalation is really important, especially when folks are having to transport to hospitals, that kind of thing.
Mm-hmm.
So thank you for that. comment,
There's
guys.
another comment from Larry Robinson from Bridgeport Veterans Affairs talking
Okay.
about vets with severe mental health situations and PSD and access to services because of COVID-19.
Yeah, and there's been a lot of questions and comments about COVID, but with the folks that I'm hearing, the professionals, leading folks across the data hearing, is we haven't seen the uptick yet, but we're all sitting there thinking it's going to happen. There's going to be a response to this whole COVID thing when it comes to folks' mental health and wellness. So it has, like with a hotline and with the text line and some of those other things, and we haven't seen a significant jump, at least up until last month. I don't know where we are here in July, but we're all anticipating an uptick, and especially educators, because if schools get open here in the fall and everybody's trying to make that plan, what are the kids' mental health going to be when they do arrive back? Mm-hmm. And do we have all the tools to be able to help them? Very much a challenge. So more to come, and I'm sure the hub and others will be sure that you get connected to all that information as it becomes available. Okay, let's move on. This is actually the next step, which is, how do we respond to a suicide death? And as you can see in this slide, it first impacts the immediate family. They say sometimes anywhere between 16 and 19 people, even as far up as 100, that are immediately impacted. I use the analogy of envision yourself standing next to a calm pond in an early morning here in the summer, and the water in the pond is like glass, and you throw the pebble or stone into the pond. The waves are really big at the beginning. Well, that's targets that inner circle. That's the most impact on the suicide. But then you can see the community or the school, how they're impacted, and how the rest of the community is impacted, which is where media coverage comes, and why we've got to be our post-vention committee has to play a role in that, to be sure that media is reporting correctly and doing the best that we can to providing clear-cut, safe messaging to them, because it does impact the rest of the community, and we need to be sensitive to that. So a really excellent visual on how suicide impacts and how we need to respond. So it's really first the family, right in the, as it says in the pink, but then how do we put those supports within the first 3 days, and then around the community or school or organization you need to do, and then again the further response beyond that, which is media. I do share a quick story. I was Channel 61 reported on a recent suicide, and I sent a letter to the editor, an email to the editor, complimenting him, because they used all safe messaging. They didn't use the word commit. They didn't talk about how the person died, but really reported on what about the individual and the things that we can do to keep those who have survived the suicide safe. So I think media is getting it, and so shout out to 61. So this is another post-vention diagram, and you can see as you look at it, lost survivors, reduced trauma, accurate information, appropriate responses, perfect messaging and education, and then reviewing your plan every year. Because you might not have a suicide in the coming year after you get your plan done. Well, then maybe even still you should look at it. Or if there has been a loss, how did we do? What things do we want to change? What things work? What things did? So really important. So I kind of like this diagram as a real good visual to that end. So, well, quick words on how to form your committee, which this is a critical piece of post-vention planning and response. And you can see through the list that it includes just about a community sector that's out there that can wire together, and really having the stakeholders. If this was an agency like a YMCA or Boys Club, obviously some of these names would still be on their post-vention plan, but there would be other stakeholders within that organization. And this is more kind of looks at it from a community. If there was if the plan was focused on just a school community, some of these pieces would be in place, but then you would have others on there that are with a stakeholder within that community that would serve on that committee. So these are the key things, and there should be a chair, somebody who is kind of waves the baton for the committee, an established person who's going to take the lead.
Tom, I'm going to interject here because Ryan from EMS commented in the chat after the social media slide, you know, how do first responders get to help the community address the social media monitoring, saying, you know, we're at the mercy of school resource officers and peers to step forward when they're seeing something of concern on social media. So I mentioned in the chat that is, you know, that links directly to this post-vention committee idea. And what I think is amazing is, you know, today we have 88 people here. I know there's some people who are going to watch the recording of this today and then join us on Monday. I think by the end of this training, we're going to have the backbone of your post-vention committee for each town. And the recordings of these sessions will be available so you could bring in the people who aren't there to really build out your post-vention committee that can really take care of all that stuff. Because social media, you know, so you need kids on social media and parents on social media. In this training right now, we have police, we have school people, we have human services, we have crisis folks, we have providers. I don't think we have anyone right now who's from a faith-based background. We have loss survivors, we have family members, we have a lot of different stakeholders, but we still don't have everyone. And it's just key that that you get all the stakeholders involved. So I think it's just a plug to say, you're the beginning of it here. You're going to walk away with the tools. And when you go back to your town and on day 3, when we put you in groups, take a look at this slide and go, who else are we going to need to involve in this?
Perfect. So some of the tasks that you want your team to include, and then just as Margaret and the gentleman who responded in chat, you know, is receiving information at a death for first responders, coordinating response steps, connect to loss folks. So you can see that there's a lot to do when somebody does pass. And I'm a big believer in being sure that the committee's communicating either through Zoom or, you know, or conference call or something like that, to take care of yourself as you're dealing with such a tragic loss. And it's your folks that are serving on this committee can all take a role in being sure these pieces are put in place. And I have a problem when over time you'll get more and more information, and you will be able to enhance your plan. Maybe not necessarily because you've had a loss, but maybe the community adjacent to you had, or another organization lost someone. And so as those information gets together, it will help to enhance your own plan and ensure that you're doing your best to act when the death occurs. So a few more things, and I, you know, first responder, there needs to be a designated post-vention team member to coordinate with these folks. the worst thing, as I talk to first responders, and there's a lot of them, they don't want to hear from 4 or 5 different people. And when there's a timely death like this, it can be a challenge for them. So if they know there's one person that's going to be the contact person, it really helps a lot. And that's certainly getting the proper information. I shared with you that story of a young person dying at one of our Connecticut malls. The information started getting out that was the farthest thing from the truth. And so if there was a post-vention plan in place, they wouldn't have been able to better care for the information that was getting out there, the misnomers and that kind of thing. And again, these post-vention team members are connected to the community. So as you meet once a day via whatever model you use, you can report back and say, well, this is what I'm seeing. Here's what we need to do. How can we best connect? And then the last thing is the designated member that provides that contact, because in the 3 days after a suicide loss, things will happen almost hour to hour. And so having one person to coordinate all of that information as team members get more stuff, so that you're acting as one and not acting as separate, I think is really important. Pretty self-explanatory stuff, but key when you're thinking about creating your committee. And then mobilize and offer support. This is really the grief support thing. It was a part of the 3 components of having a good suicide prevention plan. Is you got to have things like grief support, and just know there'll be a lot of unanswered questions. So having your team as a part of your team to be able to mobilize and connecting to the resources beyond the team that you've already recognized because it's part of your plan, get them involved, get them connected, so not only can we support those who just lost a loved one, that immediate family that's been impacted, but the community overall. Here's the communication slide. We've been talking a little bit about this already, and it's all communication outside the team, initial contact, first response should not be the focus on details of the death. It's already said that, but promote the resources, mental health resources as a family. Early on, his wishes is that they don't want it to be reported as a suicide. You can come up with strategies that I've already shared that you can do that protects the community with mental health services, but also meets the family's wishes. Here's some partners. In general, guidance of social media calls. This is that if you get a person who is good at monitoring social media, and then there were some suggestions in the chat box too, because this is hard, it's challenging. And it's really 2 to 3 days out. And why your plan needs to have a 72-hour kind of approach to the problem, because over time the social media thing will become less challenging, though you still need to focus it. And suicide loss is not about the weeks and months after somebody dies by suicide. It's the months and years. I know another lost survivor to suicide who lost his wife to suicide. It's about 8 years ago now. And he shared with me that, because everybody felt so bad and his wife passed, and it was a very untimely death. And like many suicides, no one saw it coming, if you will. And the only thing people could think of is making plates of goulash, and it took him a year and he's raised his 3 sons on his own. He's a great guy. His name is Steve. the casseroles are nice and making food for nice, and that's a way for people to respond quickly to it, and certainly don't want people to not stop doing that. When we lost arson and suicide, there were a lot of folks that came out and certainly offered that kind of help and support, but it's not the days and weeks, it's the months and years, because that's when the real healing occurs. So you need to be conscious of that, and as you begin your plan. You certainly got the guidance in public. The committee might come up with a general statement about the suicide loss, that this is the official position of the suicide loss, and you can do that in conjunctions with community leaders, elected officials, school administrators, that kind of thing. So everybody's talking the same and not differently. And then, so that from a broader perspective, if you think back to those 3 circle slide I showed you earlier, here are the kind of things you can do broader. There's that public statement announcement, watching the media, providing supports for memorials, but being sure that they're done using best practices, and we won't have a whole lot of time to get into that today, but there is a right way and the wrong way to do it. We will certainly talk about that here on Wednesday when you begin to put your plans together, that there is a right way and a wrong way to support memorials and community forums, because sometimes community forums can be very helpful. And so this is more after the fact. This might be a week later. I've seen school systems do these forums very effectively when there was a student death at in one of our towns here in Connecticut, and it worked quite well. But it was done correctly. And that's because that particular town had a post-vention plan in place. And so when the idea came up, that, well, let's do a forum, okay, and it was about mental health. It wasn't about suicide prevention training. It wasn't in there. It was really getting people to talk about their mental health and having an opportunity for community members to either express their concerns or ask questions of a panel or of experts, so that so people are not just out there feeling that they want to do something but they can't figure it out. This is a really great way to help a community help itself, and certainly help the family who has lost.
Tom, we were going to pause there just briefly. I know, and it will be brief because we don't have a lot of extra time, but can you just pull that slide back up? It's about, broader community response. So in the chat, there's some conversation about the faith, involving the faith-based community, with someone from Bridgeport saying, he's an elder in his church and can access that. I commented that, in addition, you would want to have leaders from different cultural or language groups. Like if you have a suicide in the Latino community and everyone on your post-vention team is a non-Spanish speaker and all the training and all the preparation has been done outside of that community, that's a little late at the time, right? And I wanted to highlight something you mentioned, because sort of in passing, you just mentioned elected officials. And I think elected officials often feel that they're supposed to make a statement when something happens. And so I think making sure that they have been part of, at some point, they've been part of a discussion around safe messaging before it happens, so that they, then it's easy to kind of remind them, like, here's messaging that we have and that we talked about, and let's be careful with this. So there's also other chat about involving social media influencers as part of the post-vention team. So people are already brainstorming how to broaden the team.
Great. Yep. That's exactly what this training is about. It's getting people to think about how they want to put together their response team. So I'm very happy to hear that. That's good stuff. So I know we didn't start till like 15 minutes late, and I know I'm pushing up to 11:30 hours. So let me keep moving. We talked a little bit more about the broader response, what to do, how to monitor, Again, going back to that slide with the 3 circles in it, we certainly want to be concerned about the immediate family and those who are directly impacted, but remember that there are others too. Should suicide prevention training be a part? You can read through the slide. Most experts now agree that you really shouldn't do suicide prevention training until 6 months after somebody has died. It gives time for people to heal over the loss, because the first response will be, and I've spoken to many parents like this who have lost children to suicide, whether they're young or old, is they merely want to do something. And so I want to prevent this from, for another family having to go through it. And, my counsel to them has been, take care of yourself first. There'll be time. We'll be able to revisit it. Let's make sure you have all of the grief support and counseling and all of the things that you need until which time. But it's a natural response. People will always, oh, we had a death by suicide, one of the dads died by suicide in town, and he was very well known and recognized on a lot of pieces of the community. Now everybody wants to right away start suicide prevention training. Not a good idea. Let the community as a whole, as well as the family, heal before you take those steps. So some key points to remember today that and kind of pulling today's presentation together, and we'll have time, a couple more days to even talk more about it. But after suicide, there are others that are at risk. Not even likely. I think there are, but where they are in with their mental health might not be at the point of crisis, but it could very well be. Certainly the self-care thing, we all grieve differently. I can speak to my experience. I grieve differently than my bride of 41 years and my other 2 sons. My 3 kids were very close. They were YMCA kids. They grew up at the Y, and they were they went to work with Daddy a lot, and so they were very close. And so recognizing that is so critical. And this is where cultures come into play, and some religions come into play. So you just got to understand that and recognize it, and certainly support whatever road or journey of folks want to take in their healing process. Watch out for others, and don't be afraid to ask. You don't seem well. I know we just had a very terrible suicide last week, but are you okay? You don't seem right. Let's connect to help. Let me go with you, and we'll get somebody. Let's go see Pastor John, and he's great at this stuff. Let's connect to him. Or if there's a social worker or clinician involved. I mean, these are things that we can all do to help keep each other safe. And takes threat of suicide seriously. And when there's a death by suicide, now, and because of the exposure and the things that we've learned today, that there's now a suicide threat in the community. It is. It's just reality to it. Sometimes it happens to where there is an additional death, and sometimes there's not. We just need to be really concerned about it. And just helping others to understand the contagion thing. And that goes right back to the memorial stuff, whether it's a young person or millennial, or even somebody older who was a well-liked teacher in a town, or community leader in a town. But just we need to be very careful in how, through our post-vention teams, how do we present the best way we can to keep everybody safe so that we can stay away from that contagion thing. Really, really very important. And let you take a read here for a second. I really hope that when we get together on Monday and we do the post-vention activity, this will mean a lot. This statement will mean a lot to you, because it can so easily happen, and not because in this thing that the doctor's office, was being negative or avoiding or anything. Just didn't know better. And so by having a post-vention committee and being active and educating people, we can avoid this situation. So, and then resources. There's that thought of emergency response teams. And a lot of towns are now, the smaller towns are really working with their director of public health or health directors, or those agencies within in towns and cities here in Connecticut that are required by law to have an emergency response team. This could be a place where you could attach a postvention so that you're not reinventing the wheel, you're becoming a part of. And that instantly puts all of the players that you need around the table to help deal and look at suicide, because it is an emergency response when a suicide death happens in town. And getting people to understand that and agree to that is one thing, and I think you all will be good persuaders in that form, but then actually putting some things into place is really the ultimate goal here. And so, forms, just a real quick point on forms. I've already been talking about it, but why I have the bold is if you're going to do this, and I think done appropriately can really help a community, is be sure there's healing prevention and reducing risk involved in how you do that presentation. So it could be a social worker, it could be the physician, it could be the superintendent of schools or school psychologist. We literally put together a panel. Panels should never be more than 5. You all know that rule, right? Panels of 5 that speak and have been asked to speak to certain topics that relate exactly to healing prevention and reducing risk, reducing contagion, reducing the impact that it might have on the community. Are all kind of key important things that I think if you use the forms, that you use it in a safe and proper way. So I have a whole lot more slides, but you won't see them until Monday and Wednesday. But that is the kind of the protocol part of the training. So I'm available for questions. And so let's go for it, Margaret.
Tom, great job. This is really incredibly helpful. I just want to let you know, some people send me private chats saying how useful this is. And we are right here at 11:30. I've only seen one person get off so far. So we can definitely stay on for some questions. The first one that I'm seeing in the chat is Vanessa from NAMI, who's been hearing from parents that they're having very long hold or wait times when they call 211, or when they get through, they're disconnected. And Vanessa, you can also unmute yourself, but you're talking about 211 and then them pressing option 1 to go directly to the mobile crisis line. Because I know that the long wait times happen all the time when people call 211 sort of generically. When you press that, option 1, you're supposed to go right into the crisis queue, and they are supposed to have a maximum response time. So I'd love to have you say more.
It's been both. I've heard it's for parents with kids under 18, and then also for parents of 25-year-old. And just they're in crisis and can't get the resources they need. So I've heard it twice now, so it's concerning.
Yeah, if I may jump in on that, and I'm hearing similar things, and what I'm recommending that people that have that experience call United Way office or call Wheeler. There's the 2 of them monitor the 211 line. They both share a contract to monitor or to handle the calls. But I would call the United Way. They want to know that. They don't want that to happen. I know the folks that have trained a lot of them. They're very committed, and but what they don't know, they don't know. And so we, and that's our latest. Use a little bit of honey as opposed to vinegar to say, hey, this is what's occurring, so that we can help them to help put the better, more effective research, because I really do. I think there's going to be a boomerang effect here. So I'm not surprised that they're having trouble handling the calls. Let's all be part of the solution.
And of course, I think that because we also we want to just recognize that that's a reasonable way to let them know and report it. And what I will do, Vanessa, is I will report it to the state right now after this, because they're also working on integrating the call line for adult mobile crisis with the youth mobile crisis. That was supposed to go into effect in July. Now it's being piloted in August in a couple regions, and it's going to go statewide by December. But that means that everyone will be calling the same number for crisis calls and then routed to the appropriate call center. So I will provide that feedback. Tom is right. People should report it. And at the same time, let's recognize that if you're having a crisis, the last thing you want to do is call someone and report that their system isn't working. But one of the documents I'm going to send out with multiple others after this call this afternoon is our list of all the different crisis lines, the critical hotlines, which we want all of you to print and post everywhere you go so that everyone knows about them. And so I think, when in doubt, call an alternative. But, when you're in crisis, you're in crisis.
True. Yeah.
Thank you.
Sarah Menard is commenting, how can we address the recent resurgence of police brutality and violence against Black communities? Or rather, she's interested in hearing how we can address how that has been followed by recent suicides of Black people who've been found hanging on trees. Very complex matter, but we have to address this topic.
Yeah, good question. Here's what I know, and just as I try to keep my finger in the soup, as a Y director many years ago told me, he says, you can't keep track of things if you're sitting in your office and not out in the field. So keeping your finger in the soup when it comes to these kind of issues. The data is a little unclear. There has been a resurgence of Black, and especially Black males, though they're I think it's all way too soon to look at data in a really kind of a progressive way to connect it to why that is occurring, but it has, and so yes, I think we should certainly recognize it. I think, though, that suicide prevention in the African community here in Connecticut has been under the state average and under the national averages, if you want to look at it from a strictly data scenario. The group that's more at risk beyond and over the national average is our Latino community and Latino men. So how's that all going to connect? Because I think racial diversity and building community support so that this kind of thing doesn't happen in our society. It's going to need to be included. We're going to include a lot more people to that end. But yeah, I too am concerned. Yes, there has been an increase in Black suicide. I don't know about Connecticut, but I know about nationally it's being reported that there's an increase.
I don't know that.
My Alexis is talking to me. I don't know what.
He doesn't know what you're talking about.
Oh, it's lunchtime. Where's your lunchtime? No.
I want to point out that Tina and Allie just forwarded the information that the FCC did just approve the national 3-digit number for the suicide prevention line. So yay. So and I looked at the link Allie forwarded. So it won't go into effect till 2022. So don't update all your materials yet. But as of 2022, 988 will be the national line everywhere, which is fantastic because for people, even with that Logic song, it's kind of hard to remember the national lifeline when you're in a crisis. But this is an opportunity to also say, if you don't all have the crisis text line and the National Suicide Lifeline saved in your phone, you should do that, and you should encourage those you work with to do the same. I'm going to type them in the box right now. And great. And Madeline from Mobile Crisis in southern, in the southern part, Child Guidance Southern Connecticut, is providing her information here. If you want to unmute yourself and add something here talking about Mobile Crisis, that would be great.
Hi, yes. Sometimes we are getting problems, but Thomas provide an excellent point. United Way will be just to the point, just to talk with people in charge of the line. We are working and we are not receiving a lot of calls. So I'm wondering if there is a technical issues. We are available. We can provide support. The population that we are serving is children and adolescents, and is not adult right now. So you can reach me anytime if you have any. The towns that we cover is Stamford, Darien, Greenwich, New Canaan. I don't know what is the town that the person who said that the family is, what town was that?
It was actually that would make sense then. That one was Danbury for the under 18.
Yeah, please reach out to me. We can talk a little bit more. Maybe this is something that we can brought up in my meetings with statewide, and maybe just to target the specific town that is having problems.
Thank
That
you.
would be great, Madeline, if you can report that up sort of within the Mobile Crisis chain, because the issue could have been Danbury, or it literally could be like the connectedness through 211, right?
Yeah, it's concerning now that, I'm aware of it, because we are not receiving calls the way that the volume is very low.
Okay. I know that a few people have gotten off the phone. We still have 72 of you though. So just to acknowledge, you feel free to leave us and rejoin us Monday. We hope everyone's going to be back on Monday. I'm going to send a bunch of documents out to the list after this. Tom, are you available for a couple more minutes if people want to linger?
Yep. I'll be right back though. Give me a minute, nature calls.
Okay, potty break or goodbye, everyone. If you are leaving us, thank you so much for joining us and have a great weekend.
Thanks, Margaret. See you guys next week.
You bet. Take care, you guys.
Thank you for being patient.
I think that comment from me, gave everyone permission to leave, and they're all saying thank you. But there are so many comments about how this is great information. People are really excited about it. We still have 24 people on the phone though, so anyone who wants to, use Tom's expertise or ask a question or make a point, go ahead.
I guess I'll be the first one, Tom. Larry Robinson from Bridgeport, veteran.
Larry.
Awesome presentation. The information is very valuable and it would be well used. Hopefully, I would never have to use it, but in the case that I should, I will have the correct knowledge and understanding how to approach a situation with sensitivity. My question is, well, I'm the director of Bridgeport Veteran Affairs in the city of Bridgeport, and I'm finding out there's a lot of older veterans, but now a lot of younger veterans who are dealing with PTSD. And because of, as I stated earlier, because of the interruption in their services due to our current situation, we are having to deal with them in the form of them feeling that they don't want to live any longer. They don't know if it's worth living any longer. I can't do without my counselor. I can't do without my therapist. But I've noticed that these situations become more aggressive toward taking their lives. None of them have done it yet, but they are begin to focus more. Well, let's end this. Let's stop this. And so I appreciate what you is doing today. And Margaret, I appreciate you putting all this together because it's much needed, and especially among the veteran community and also in the faith-based community, which I'm a part of.
Mm-hmm.
You know, I comment about the faith-based community, and thank you for mentioning that, Larry. You know, I know you're doing a lot with veterans, but if when there isn't a really good post-vention plan in the community,
yes,
guess where the post-vention happens? At the churches.
Church. Yes,
they do. I've done post-vention training for a group up here in the valley of ministers and priests and folks from all kinds of faiths that just like, what do we do, Tom? Because what happens is if there's not a good plan and somebody's struggling, and they're connected to their faith and to their faith church community, that's where they end up in. And so trying to work with clergy who are, in my experience, have been really connecting to this whole issue, but giving them as many tools as they have, resources, and being able, so when they have a parishioner that's at risk, and they need help, they know where to get it in your community. And again, that's where I think a post-vention committee member should be somebody from your faith-based community, who has the passion and the time and the drive to participate, because they play a very important role. And we don't know, that's kind of silent out there. But as I, in the past 8-10 years have done my journey, I can tell you that's it's many times where people end up, and I'm going to raise my hand on that one, because that's where I ended up getting support. So.
Yeah, I've had some friends who went through that situation, and the place where they was located, there was no one there for them to reach out to. There was no one there that reached out to them.
Right.
So when you talked about the trauma that it does to those that remain, it's so devastating, especially when there's no one there that to give them souls on some piece of it, just to give them an ear to listen to. But some of my takeaways from what you already presented is that now I need to become more diligent in getting the faith-based community involved into this, that they have some training as to what to do and what steps to follow.
Yeah. Good for you. Yeah, I agree. And it's just stuff, the whole stuff. Anybody else up there?
Yeah, we've got about 20 people left. So anybody more comments or questions?
I'm going to put my phone number in the chat. If any of you that's still on might be challenged right now and would like to give me a call, there's my cell phone. You can call me and know that, and I'm sure Margaret too, same. I'll be here just for someone to talk to.
May I make one more statement? It's to be transparent. When I was diagnosed with stage 4 prostate cancer, my first thought was to drive my car off the bridge, because I did not want to go through the ordeal of suffering. I died with cancer. Wow. And to me, I thought that it would be a better deal for my family if I did it suddenly instead of linger and let them watch me deteriorate. So I came to the conclusion that I would do it quickly. Let them get over it quicker instead of watching me deteriorate through maybe years of chemo and therapy and all of that. So when I saw this subject about suicide, I can understand that it's a very fragile bridge you walk over.
Yes.
And I was ready to go there, but it was one person that reached out to me, and that was my pastor. I called her. Yeah, I called her and I said, Pastor, I got staged for prostate cancer. They gave me less than 2 years to live, and I'm not going to live like this. And she let me talk and talk and talk. And then she finally said, what is your favorite song? I mean, it just completely blew my mind. And then I said, well, love lifted me. But then she said, how can love lift you if you want to put yourself down? And then she did one other unique thing. She said, what is your favorite scripture? And I said, I would have fainted unless I believed to see the goodness of the Lord in the land of the living. But then she said, how are you going to see his goodness? You're going to commit suicide. No, totally flipped my way of thinking. And I, since that day, I said, if I ever get an opportunity to help someone else, I want to make sure that I'm prepared. And this, again, I know I'm rattling, but this information is very valuable. And thank you.
You're welcome. And thank you for sharing your story, Larry.
Yeah, thank you.
I'm glad you're still with us.
Yeah, me too.
No kidding. For those who are still on the call, again, you've got mine and Tom's cell if you have anything you want to discuss privately. But so I also just put out a message. We are going into small groups Monday. We have a number of people who agreed to be facilitators, but then we've had even more people join the training. So we may need more facilitators for the small groups. So just let me know if you would be interested in doing that. And it's going to be very simple. It's just going to be, asking like 3 questions and reporting back to the group and sharing the information with us.
Great. Well, thank you, everybody, for attending, and we'll see you Monday.
See you Monday. Bye-bye.
Activity time. Yay.
Activities. Yeah. Tom, thanks a million. This was really great. You should see the chat. Everybody's positive about it. And also, I just was looking at my email, and the Fairfield folks are already literally like, when can we have our committee meeting and who else can we join in? And I'm like, hey, why don't you get through the whole 3 days first? Then you'll be ready to go. But so maybe they can get people to the training for Monday, more people. Just really exciting. So, hey, Giovanna, if you're literally there and can hear us, can you please show us Mateo?
Of course. Hold on. Hi, everyone.
Hi.
Hello.
Nice to see you.
I know. Nice to see everyone. Oh, you know what? I vacuum while he's sleeping. The dog barks. He's good.
Listen, maternity leave is no time for you to vacuum. That's Bruno's job.
Say hi, Mateo.
Congratulations.
Oh, he's so cute. Wait, Tom, don't talk, and let's if we're quiet, it'll stay on him.
Yeah.
Oh my God. I love the little sweatshirt. He's already a little jock.
Mm-hmm.
He's like a soccer player like his dad, right?
Yeah, I threw on a sweatsuit today. I said, it's raining. It's raining today, so might as well put on a sweatsuit.
That's awesome. How are you feeling?
Good. Good. Tom, you did a wonderful job. Thank you for the training. It was excellent.
You're welcome.
Oh, I just realized we're still recording. I'm going to turn that off. No, we're not. Yeah, we are.